Cute dog. All right, well, switching gears a bit, but staying with health news this morning. According to the Federal Office of Minority Health, African Americans are affected by serious diseases and health conditions at a far greater rate than other Americans. In fact, African Americans suffer an estimated 85,000 excess deaths every single year from diseases that we know how to prevent. We're talking about heart disease, stroke, cancer, high blood pressure, and diabetes. That's why Dr. Michelle Gourdine is here. She used to be the Baltimore County Health Director, and she's now the author and the CEO of her own company. She joins us this morning. Thank you for coming in.
Glad to be here.
So you wrote this book, Reclaiming Our Health. What made you write it?
Well, just as you said, African Americans tend to be more affected by serious health conditions than other Americans. And I wanted to sort of get behind why that is. What's the issue here that causes us to have increased rates of disease and death, and what we can do about it?
Why is it? What's going on?
Well, there are a lot of factors. Obviously, the bottom line is if you have more risk factors for a particular disease, you're more likely to get it. We all know what it is that we need to do to improve our health. We need to eat right, we need to exercise, we need to maintain a healthy weight and get regular checkups. But there are cultural factors and environmental factors that impact all of us in terms of helping us to be motivated to do what it is that we need to do. And that's what this book looks at.
Because the book is rather interactive.
Yes, it's very interactive.
So if someone were to pick this up, what would they find, and how would it help them? Because it's very hard to change your behaviors.
Absolutely. And what I wanted to look at was what affects our behavior from a cultural standpoint. Take myself, for example. I'm an African American. I'm a doctor. I knew what I needed to do in terms of eating and exercise, but even I didn't always do that. So it goes beyond knowledge to other factors, like, for example, let me give you a good example, and this may seem kind of funny, but it's actually very serious. African American women have a very special relationship with our hair.
Right.
We don't have wash and wear hair. If you go to a beauty salon any Saturday afternoon, you're bound to find it filled with African American women who spend hours and hours getting their hair done and lots of money to get their hair done. So if you expect that lady who was in the salon on Saturday to then go to the gym on Monday and work out on the treadmill for an hour and sweat out that hairstyle.
After they spend all that money
It's
and time.
not happening.
Sure.
And you know, it may seem frivolous to some people, but that actually is an issue that we need to address. Once we understand what motivates people's behavior, then we can give practical advice on how to change that. So for example, for that woman, you can suggest a different hairstyle that's more durable. You can suggest different types of hair products that might help the hairstyle withstand the sweating from the treadmill, those types of things. But that's the practical advice that people can use that then will help them overcome that barrier to exercise, for example.
And I'm sure that's something that you run into, are ways to try to fix these problems and cultural issues.
Absolutely. And then other issues are not necessarily individual, they're more environmental. For example, I would see patients and I would advise them, my patients are kids because I'm a pediatrician, advise the parents, look, your child needs to eat more fruits and vegetables, they need to cut back on the soda. But if they live in neighborhoods where there are no supermarkets,
right. Which is a
huge problem, where you've got corner stores where there's not an abundance of fresh fruits and vegetables, then there are things that we need to do on a broader scale in our community to make sure that everybody has equal access to healthy foods.
You know, when we're going through the list of all these things that are so serious, diabetes, high blood pressure, but they can be changed.
Absolutely, they can be changed. And that's the hopeful message in this book. That, first of all, if your family has a history of diabetes or high blood pressure, it doesn't mean that you are destined to get it. And even if you do have those conditions, and there are things you can do to prevent complications, this book talks about all of that.
All right, well, tell everybody how they can get Reclaiming Our Health.
Absolutely. Reclaiming Our Health is available in all of the major bookstores today. It is out today. It's also available at your online booksellers like Amazon.com, BarnesandNoble.com. So please go out and get it.
Okay, well, Dr. Michelle Gourdine, thank you so much for coming in, and thank you for writing the book.
Thank you very much for having me.
Great to have you in the community. You'll have to come back sometime.
Glad to.
All right, Charlie.
All right, Megan, thanks a lot.